Hello, and welcome to our Facebook Live series. Today, we're going to talk about a very fun topic and a serious topic, sex in the heart. I'm Dr. Fazane Sabi, board certified OBGYN, and I am thrilled to be here with you today, along with two of my dear friends and amazing colleagues, Dr. Amaya Kulkarni, a board certified cardiologist with the Mid-Atlantic Permanente Medical Group, and Dr. Carolyn Gorman, a board certified OBGYN with the Mid-Atlantic Permanente Medical Group. Thank you guys for joining me, and I'm really looking forward to talking to you today. Dr. Kulkarni, we'll start with you. Do you mind just giving a little bit of introduction about yourself?
Sure. My name is Amaya Kulkarni. I'm an interventional cardiologist practicing primarily in Northern Virginia. I have a special interest in adults with congenital heart disease and cardiac obstetrics. I do a bunch of things with the Mid-Atlantic Permanente Medical Group, and I'm excited to have this conversation today.
Awesome. Thank you for joining us. And Dr. Gorman.
Hi, yeah, I'm Carolyn Gorman. I'm one of the obstetrician gynecologists practicing out of the Capitol Hill Medical Center. I also have a specialty in women's sexual health and have talked to groups about sex after a diagnosis of cancer, sex as you age. And so this is just one more that I think is just as important and hopefully a popular topic.
Awesome. Thank you both for your time today. And for those of our friends and colleagues who are listening live, we would love to hear from you. Every time we do one of these sessions, I actually learn so much from the questions that you guys ask. So we love your questions. Hopefully you won't stump us, but if you do, we'll research it and get back to you soon. But we really would love to hear from you. So let's go ahead and dive in. You know, a lot of people talk about sex, and there's a lot of myths out there. There's a lot, you know, after especially a chronic condition or a disease, a lot of concern about whether or not it's good, it's okay to have sex. So Dr. Kulkarni, I'll start with you. As a cardiologist, you know, many times, especially people with heart disease, we will ask questions about, you know, is sex good for you, and is sex good for the heart? What do you normally tell your patients?
Yeah, so I would say that I want to start by saying this is probably the most common question I get asked after a heart attack. And so everyone is thinking about it. And so I'm glad we're talking about it in the open. And I encourage everyone to talk to their doctors about the question you just asked. The way that I think about sex is like vigorous exercise. And so if your physician thinks you are okay to do vigorous exercise, then you're okay to have sex. And there's so many beneficial effects, not just in terms of the actual exercise component of sex, but, you know, it releases dopamine, it makes us feel good. All of these things that are really good for us in general stem from sex. And so I think that in general, if it is safe, then it is a good thing to be doing.
Awesome. Thank you. I know that, you know, there have been a lot of questions, especially, so you mentioned after a heart attack, but if someone has a cardiac stent or, or has had cardiac surgery, if someone has a pacemaker, are there any contraindications or what should people be aware of?
You know, so this is a bit of a complicated question because I think it's variable patient to patient, but I think in general, the way that I would think about it is, one, if you are cleared for exercise, you're usually cleared for sex. And two, paying attention to your symptoms is really important. So if just like on a walk, if you get chest pain after a heart attack, your cardiologist will tell you to stop. If during sexual activity, you start to notice yourself getting chest pain or shortness of breath beyond what is normal for that level of activity, that's a sign that you probably want to stop and have a conversation with your doctor about whether it's safe for you or not. But short of that, there are not any sort of regular restrictions for the vast majority of patients. There's a very small group of patients, and if you're in that group of patients, your cardiologist probably told you it's restricted, for whom sex is not safe, but it's like 0.01% of all the heart patients we see. So it's very rare that it's contraindicated.
Perfect. So let's talk. So we talked a little bit about someone who's already had a cardiac event, but one of the things that we pride ourselves on is the focus that we have on preventing cardiac disease and reducing the risk of cardiac events. And so we have many of our members and many of our patients who are on medication, whether it's for decreasing blood pressure, and diabetes, cholesterol. And so many times we hear the complaint about decreased sex drive as a result of being on some of these medications. So I'll start with you again, Dr. Kulkarni, and then I'm going to pivot over to my colleague, Dr. Gorman, because she and I actually have had many conversations about this, in our OBGYN practice as well. So Dr. Kulkarni, what do you tell people, especially if they're on medications that decrease their sex drive?
So I usually say it's worth a conversation. Every medication has risks and benefits in the individual person. And for that individual person, the risks and benefits may be different. And there are certainly some blood pressure medications that will reduce either sex drive or the ability to get an erection. And I think that can be disconcerting for patients who are experiencing those symptoms. And so I think if you feel like something may be related to a side effect of medication, asking the question to your doctor about what is the risks and benefits of this particular medicine for me is important. I think for some patients, we can't stop the medicine because it's protecting you from major events like heart attacks and strokes and death. And so we can't stop the medication, but there's often things we can do to still allow patients to have a fulfilling sex life, even on those medications that reduce their drive. And I know Dr. Gorman is quite the expert on that.
Yes. So, many times, especially in our OBGYN practice, women in their 40s, 50s, start complaining about just decreased sex drive, especially if they're on medication, but just going into menopause and perimenopause. Dr. Gorman, what are some of the key pieces of advice that you give your patients, and what are some precautions about some of the medications that are out there?
Well, it's such a multifactorial concern. So it's really hard necessarily to pinpoint one exact thing. When I talk to patients about libido and their sex drive, I really try to look at the whole person, and their medication list is just one component. Often it's just not one thing, but really just kind of a whole, it's multiple things at the same time. So, one of the biggest things that I recommend to my patients is like great communication with their partner and their physicians. So sometimes women that come to see me haven't even really opened up to their partner about their concerns. And it's really hard then to kind of get the partner to be, part of the treatment plan in terms of libido if they don't even know that it's a concern. And then, as an OBGYN, I'm not necessarily an expert, or I definitely defer to my colleagues in cardiology and primary care regarding cardiovascular medications. And so again, I really want my patients to talk to their primary care physicians or their cardiologists about the medications, because often they're telling me their concerns, and I recognize that there might be other medications that might be helpful. So they need to actually have that conversation with the cardiologist. Often, with libido, it's just getting the conversation started. That is the biggest first step. And that's something that a lot of patients are just embarrassed to do or worried they're going to be dismissed. And I hope that this Facebook Live discussion is just one way of showing patients and women out there and men that we really care about it. It's not something that we want to ignore.
Absolutely. One of the questions that we commonly get in OBGYN, but it also affects cardiovascular health, is the use of hormone replacement therapy, not just estrogen and progesterone, but also testosterone, and some of the risks associated with women being on testosterone supplements. Can you talk a little bit about that, Dr. Gorman?
Sure. I'll first kind of address like hormone replacement therapy in general. I think, and you know, many years ago with the Women's Health Initiative trial that came out, I think hormone replacement therapy got a really bad rap. And I think that studies that have come after the initial information have really found that some women can really benefit from hormone replacement therapy. And it's not bad necessarily for everyone. And I think we need to really find those patients that are good candidates for hormone replacement therapy, and looking at their cardiovascular health, looking at hypertension, looking at their cholesterol and things like that, and to see who would fit that person. Now, in terms of testosterone, that's a little bit less clear, because first of all, I will say there is no FDA approved testosterone medication for women, period. So anything we do with testosterone is going to be off-label and not necessarily FDA approved for women. And so I really make that clear. There are also limited studies for women with testosterone. I do feel that for some patients, having testosterone, especially in a postmenopausal woman, there is a time and a place for that. And with really good counseling, women can try testosterone. Now, I feel like, again, it's not going to help everybody, and they have to really kind of be aware of the pitfalls. Now, in terms of cardiovascular health, some initial studies that have really looked at, 2-year projections haven't found necessarily a significant increase in blood pressure or cholesterol. So that's a good thing. But we don't have long-term studies of testosterone on women.
Thank you for that. So, talking a little bit about the intersection between obstetrics and cardiology, and Dr. Kulkarni, you mentioned this in your opening. There is a lot of concern for reproductive aged couples who are having sex, if, especially, the woman has a history of cardiac disease, cardiomyopathy, or any other cardiac issues that not only could impact her health during sex, but also during pregnancy. What are some of the common things that you hear as a cardiologist, specifically around pregnancy and cardiovascular disease?
Sure. Yeah, I think it's a great question. And so I actually thought you were going to ask about sex in
We'll do that too.
in women with existing cardiovascular disease. So starting with the question you asked about the common questions around pregnancy and heart disease, overall, I would say that in the last 12 to 15 years, we've become much more permissive in who is able to get pregnant, because we know we're able to get patients through pregnancy with much more frequency and safety than we initially thought. So 15 years ago, basically anybody with any sort of cardiovascular condition, we were saying you shouldn't get pregnant. And now I would say it's probably fewer than 1% of patients that I see in the cardiac obstetrics clinic who I say you should really never get pregnant. And so from that perspective, we're really permissive. What I'd say is it doesn't mean sort of if you are in a category of higher risk that you can just, that you can safely get through pregnancy without any help. And we have cardiac obstetrics team in the Mid-Atlantic Permanente Medical Group. We have a really robust cardiac obstetrics team that sort of handles these complex situations to make the birth feel as normal as possible. But that's certainly, so you don't want to do it on your own, but it doesn't mean you can't do it at all. And the theme of today is every conversation is individual. And so if you are, worried or concerned, or you think that you may be at a higher risk category for pregnancy because of your existing cardiovascular condition, you should have that conversation with your gynecologist and or your cardiologist, preferably both. The second question, I think, which we also get asked, is about in women who have existing cardiovascular disease, what is the safety of sex in those populations? And I think that it can create a lot of anxiety, and both for men and women. If you have a cardiovascular condition, you don't want to hurt your partner's overall health with sex. And I think that the best way to sort of have that discussion is through literally you and your partner have that conversation with your cardiologist, and we can talk through how to make it as safe as possible, how to identify risk features that should maybe make you pause, and by sort of having a plan and having an honest conversation, I think you can safely have sex even with significant cardiovascular disease.
Awesome. Thank you for that. We do have a question, another question that came up in the chat. I'll go to that in a moment. But one of the things that I don't want to lose track of is a lot of times, in our conversations, we have talked about signs or symptoms that, if you have a certain symptom that you should stop having sex, or you should, pause and talk to your cardiologist or your primary care physician. Dr. Kulkarni, can you tell us what some of those signs or symptoms are that people should be looking out for?
Yeah, absolutely. So there are sort of three big ones, I think. And so the first one is if you have chest pain that's severe, that feels like if you have angina, like your angina symptoms, that makes you feel like stopping. That is, it's usually relatively dramatic. So if you have chest pain, certainly stop right away and figure out what's going on before you continue. These sort of two other symptoms that are not as clear cut, but are important as well. One is severe shortness of breath. So shortness of breath out of proportion to the activity that you're doing should be a signal that maybe something's not right. And then the third one is dizziness or fatigue. And so if you have sort of profound or overwhelming dizziness or fatigue during or immediately after sexual activity, that's sort of that's another signal that maybe something is amiss. What I'd say for all those categories is those are the same symptoms we look for in any sort of exercise. So if you're having these symptoms during sex, you're probably having them during, when you're on the treadmill or the bike or things like that as well. The reason why sometimes we see these symptoms during sex and not during other activity is because for some patients, that is the most vigorous exercise that they are doing. And so it may be the only opportunity to sort of get your heart rate to enough of a rate to generate the response.
Thank you for that. So we were waiting for this question. We've had it on our list, an important topic, one that I think when we think about sex and the heart, many times this is one of the first things that we think of, and it is medications or treatments for erectile dysfunction and the use of Viagra. Can you, and maybe Dr. Kulkarni, I'll start with you from a cardiologist perspective, and then Dr. Gorman, we'll go back. We touched on this a little bit with some of the hormone replacement therapy that we have for decreased libido, but specifically for erectile dysfunction, some of the medications that are out there like Viagra, is that safe to use? What are some precautions that you discuss with your patients?
Sure. So first thing I'll say is that if you have an existing cardiac condition, whatever that cardiac condition is, and you want to try medications for erectile dysfunction, the conversation should be with your cardiologist first, because there are a lot of factors that cardiologists think about in deciding whether erectile dysfunction medications are safe for you or not. With that said, for the vast majority of patients with existing heart disease, erectile dysfunction medications like sildenafil or Viagra, and in some cases, the longer acting ones like tadalafil or Cialis are safe. The couple of things that we think about and worry about is that the way that sildenafil or that category of medications work, Viagra work, is that they dilate your blood vessels. Right? They increase blood flow to the penis by dilating the blood vessels. And so, in somebody for whom a lower blood pressure is a risk factor, so somebody who, if a sudden drop in blood pressure can put them at risk for a cardiac event, we want to be very cautious about using a medication that dilates the blood vessels. The second thing we think about is interactions with other medications. So if sildenafil by itself may not cause you a problem, but you may be on another medication like a long-acting nitrate like Imdur or nitroglycerin pills, that can, when the two together act synergistically. So one by itself may not be a big deal for you, but you take the two together and it's a problem. And so those are other situations where we have pause. And then the third thing we think about is that sometimes sildenafil, because it does dilate the blood vessels all over your body, can sometimes allow you to do more exercise than you otherwise would do. So it pushes you to, the usual signals that stop you from overdoing things go away. And so that's sort of the third thing we worry about. So when I talk to my patients about using sildenafil, I talk about the interactions with medications, unsafe drop in blood pressure, and then I talk about what vigorous exercise looks like, whether it's during sexual activity or on the treadmill or on the bike.
Perfect. Thank you for that. So one of the other questions that came in, especially for someone who has recently had a cardiac event, whether it's a heart attack, it's having a surgery or procedure for the heart, is the anxiety and the worry about restarting and re-engaging and having sex. So I'll start with you, Dr. Kulkarni, but also Dr. Gorman, I would love your thoughts on this as well. So for someone, who has had an event, who has stopped having sex, what are the things that they need to consider, and what are things that we can tell them to help decrease their anxiety?
I think this is probably the most important question we're going to answer today, because I think it's probably something that every single person who's had a cardiac event is thinking about, because it's one of the returns to normalcy, right? And so it is one of the things in our normal lives that it signals that we're not, on the precipice of a severe illness, that it's sort of a return to normalcy. And so what I always say is that if you wait the appropriate amount of time after a cardiac event or procedure, depending on the procedure, it's 2 to 4 to 6 weeks or longer. If you wait the appropriate amount of time and your cardiologist has said it's safe, then I think it is safe. And so the first thing you should hear is that it is absolutely safe to have sex after a cardiac event, and as long as you're sort of following the appropriate guidelines. That's thing one. The thing two is the way that I usually suggest to patients and their partners to return to sex after cardiac events is to, again, view it like you would any sort of exercise. Because the real part of sexual activity that is potentially risky is that you are going to increase your heart rate and the amount that your heart has to work during sexual activity. And so what I say is think about it like vigorous exercise. View it the way you view your return to the gym or the treadmill or walking. Take it easy at first and ease yourself into it, and be comfortable with having the conversations around your anxiety with your partner in particular, because that's the most important part. I think if you create comfort with your partner, you'll get through it. And that's the last part. You'll get through it. I think that most couples who experience a cardiac event do resume sexual activity. So there is a light at the end of the tunnel, if you will. So.
Awesome. Thank you for that. And Dr. Gorman, I get this question several times a day around, if there's been a pause in sexual activity and, a woman has not had intercourse for a while and then wants to resume. I think there's also a lot of anxiety around that, whether or not it's after a personal event or her partner's event and cardiac event. So what are some of the advice that you give for someone who maybe has not had sex for a while and wants to resume, especially for women?
A couple things. First, I want to echo what Dr. Kulkarni said about having the conversation with your partner, because whether it is that your patient that had the cardiac event or your patient's partner, it may not be just the patient that's having anxiety about having sex again. It often is also the partner not wanting to hurt their loved one. So talking about it, potentially having both with the cardiologist to have the conversation, I think that's really, really important. Now, for women who are returning to having sex after a while, it depends a little bit about what, how long it's been. Now, if it's been a brief period of a couple weeks, there may not necessarily be any difficulty getting back into it. Maybe if it's a woman that's actually had, several months off of having sex, that initial time of having sex, there may be a little bit more dryness, a little bit more tightness. And that's when, conversation, if you assume that it's just going to hurt and it hurts and it continues to hurt and this just must be normal, that's wrong. Okay. If it hurts and it continues to hurt, you need to talk to your gynecologist, because there's so many things that we can do that are safe, such as a topical estrogen product for women, or physical therapy for some tightness and muscle tension that we can do to help sex feel better. So don't just assume that pain is going to be the norm. It shouldn't be the norm. And how can it be enjoyable if we're having a lot of pain? So please talk to the gynecologist about that.
It's interesting. I think in both of our, discussions, the key things that you have said is how important the conversation is with partners and how important the conversation is with your physicians. And I think, for some people, this is easy to talk about. For some people, it's not, and it's very personal. So, and I'll start with you, Dr. Kulkarni, and then go back to Dr. Gorman. What are some things that maybe will help someone who's listening who is worried about this, break that ice and talk to their physician or their partner? What is something that we can help them find their way to have this conversation?
Yeah, I think it's a great question. And I think that it's difficult, because if it feels awkward to start the conversation, it's not going to not feel awkward no matter how hard you try, right? So I think you start by asking the question, and maybe what will give comfort to our patients who are listening and watching is that physicians want to have this conversation. So and in fact, I would say that the first visit that I have with every patient after a heart attack, this is one of the things that I talk about, because I think patients and physicians both want to have this conversation. From the physician's perspective, we want to, make you feel better, but we also want to give you back your normal life, whatever that looks like. We want to give that back to you as much as we can, especially after a major life-changing event like a heart attack, right? And so this, to me, is on that road. And so, it's going to be an awkward conversation, especially if you're not used to the language or the way having the conversation. It is going to be awkward. And I think if you just are comfortable with the first step in that conversation and know that your physician, whether it's your cardiologist or your obstetrician or your primary care doctor, really wants to have the conversation with you, if it's something that preoccupies you, I think that will go a long way. But if you just start the first sentence, we will take over from there. We will be happy to have the rest of the conversation.
I'll add that. Oh, sorry, go ahead. I'll add that I think it's one of those questions, just generally any concerns about your sexual health, that I like to bring up when I see patients for routine visits. It kind of invites the topic, gives patients permission to start asking these questions. I think in cases where a patient may not necessarily be in front of me at the moment they're having a concern, sometimes even sending a message on their kp.org account might feel a little bit more, not necessarily anonymous, but feel a little bit safer than being in front of me. I think that's also just a good way of bringing the topic up. It's often something that can't be just a quick, reply for a secure message. And it gives me the opportunity to know what their concerns are and to, invite them to join me on a telephone visit or a video visit or in person if they prefer that. So there are lots of ways to address it. And if they just, again, just bring it up, hopefully we're asking the questions. I'm glad to hear that Dr. Kulkarni just, normalizes that from the very beginning. And I think that's what we need to do, and kind of let patients know that this is often a concern. You also mentioned, how can patients talk about it with their partner? And I think that's where I would suggest partners who are concerned, how they approach it with their partner. They can always refer back to me and say, I spoke with my gynecologist and she said that lots of women have concerns about X, Y, and Z. And so that kind of, again, normalizes the concerns, normalizes the conversation that they're going to have with their partner.
Awesome. Thank you for that. So, we're talking about sex and the heart, and we specifically have spent a lot of time talking about people who have already had a cardiac event, surgery or procedure, or on medication. I would love to take a step back and say, for people who this is an important part of their life, what are things, and Dr. Kulkarni, I'll start with you and then I'll go to Dr. Gorman. What are some things that people can do to make sure that they stay healthy in general, but also in order to be able to enjoy, a satisfying and long sex life?
Yeah, great question, because that's a question that affects everyone in adulthood, right? And so, I would say that things people don't know that can affect sexual health, in particular for men and erectile function. If your cholesterol is high, if your diabetes is out of control, if your blood pressure is high, those three things individually or together can contribute to the difficulty, in getting an erection or keeping one. So if you have some sort of sexual dysfunction, I think that, getting your cholesterol checked, getting your hemoglobin A1C checked if you haven't yet, making sure you're checking your blood pressure, those three things are critical. Now, the fourth thing that I think has become much more common in the pandemic is the effect of stress on sexual health. And so stress is a cardiovascular risk factor. The unabated adrenaline surge, that fight or flight response over a long period of time, does increase your risk of developing coronary artery disease. And it also develops your risk of having sexual dysfunction, both in interest and in ability to have an erection. So I think that those would be my pillars. If you don't know what your blood pressure is and haven't checked it in over a year, you should check it. If you haven't checked your cholesterol in the last 5 years, you should check it. The A1C, I think that's every year or every other year. You really should know that, especially if you're over the age of 40. And if you are not attending to your mental health or stress levels, check in with yourself about that as well.
Yeah, I'm so glad that you talked about that. I think, we don't talk enough about the impact of mental health on both your heart and sex. And so I think that's a really, really key factor for us to keep in mind, especially because of the last couple of years that we've been through. Dr. Gorman, we hear this a lot in our clinic. What are some key things of advice that you give women just to stay healthy and have a long, enjoyable sexual life?
Sure. Well, one of the things that unfortunately for women, I try to remind them is the vagina is sadly a use it or lose it organ. I mean, it meaning that if you are not regularly having some kind of penetration and you're getting closer to menopause or after menopause, that your vagina will generally start to shorten and narrow. So if you are not with a partner for a prolonged period of time, it can be a little bit more difficult getting back into sex, because there actually has been a change in the size of your vagina. Now, if that's already happened, we have things that we can do to help. Yet, it would be nice to have some prevention ahead of time. So I'll have patients come in that will say they're not sexually active, and it will be something that I will kind of bring up with them so that I say, well, if you're, looking forward to being sexually active in the future, here are some things that you can do. Sometimes it's just having some form of penetration. Sometimes it's just doing a little massage on the outside of the vaginal opening, at the vulvar vestibule, to kind of just keep some of the tissue open and spread out. Vaginal estrogen, again, is a great medication that we can prescribe safely for the majority of women that gives some elasticity back to the tissue in moisturization. So these are things that I discuss with women, not just who have already passed menopause, but women that are in their 40s, because often symptoms of menopause and dryness start even before their period stops. So it's an issue for women in many different decades of life.
Absolutely. So I think, some of the key things that I have heard from you guys, if I could summarize, is one, in general, making sure that we're paying attention to our diet and our physical activity, making sure that we are staying active in our lives will also help both with our sexual health and our heart health. And so prevention is the key, as with most conditions and lifestyles. So really paying attention to exercising, eating well, taking medication if we have to in order to decrease chronic conditions. The other thing is, if there has been a cardiac event, most people are able to return to a satisfying and healthy sexual life. And so that is a key component. And we also talked about how important conversation is, both with our partners as well as with our physicians. In the last few minutes that we have, are there any other key things that you guys have either heard in clinic or would like to share?
I'll bring one point up, is that, over our lifespan, what sex looks like for us can change. And so what it looks like as a 20-year-old or a 40-year-old or a 60-year-old, or before a heart attack or after heart attack, it may look different. And that's not something that we can always change. Yet it doesn't mean that it can't be just as satisfying. So part of the change that goes on is kind of looking for a new norm for some couples, and that new norm can still be a satisfying sexual experience and different than it was before. So there's a little bit of a recognition of, this is what the new norm is going to be, and let's find a way, communication again with their partner and their doctor, of how we can make it the most enjoyable for both of us. And that's really important to know.
I love that. That's such great advice. Dr. Kulkarni.
Yeah, the one thing that I would want everyone to take away is that almost everybody is thinking about having this conversation. And so if you are anxious about it, having the discussion with your doctor and with your partner is really important. If we could normalize these conversations with, interactions with cardiologists and primary care doctors and obstetricians and urologists, if that's appropriate, I think that we would go a long way for our own mental and physical health. And so I would encourage you, if you're thinking about sexual health in any way, you should have a conversation with your doctor about it.
Awesome. Thank you both. And I always learn so much. Hold on. There's one more question. Thank you, guys. The last question that came in is there a time limit on how long a male can be on Viagra?
I could take that one. There is not a time limit on how long somebody can be on Viagra. What influences whether we have to stop it or not is those things I was talking about earlier, in terms of, if there's an interaction with a medication, or if you're in a condition where it's not safe to be on the medicine anymore. But short of that, there's no time limit. There are some patients who start on that on Viagra or the equivalent in their 40s and are on it for as long as it's been around. So I think it's been around for 30 years now. So we can say at least that long. So,
Perfect. Thank you, guys. I always learn so much from you, and I really enjoy your expertise. I really want to thank everyone who has tuned in for allowing us to share a little bit of our time with you and discuss this really important topic. We look forward to seeing you on future Facebook Live events and hope that you have a wonderful day. Take care.